Hello everyone. Today in this lecture I will deal about the anatomy of mouth, and it is also to be called as oral cavity or buccal cavity. So this is the first part of our GI tract from where we ingest our food or fluid, and from there it travels all along the GI tract. So here in this lecture we'll discuss what all structure comes under this. But this mouth also contains some accessory organs like teeth, tongue, salivary gland, but that all we'll discuss in another video. So there is one entrance point of mouth and one exit point of mouth. So the entrance of mouth is called lip, from where we can open our mouth, okay, and the exit point where our food goes back. That is, it goes along the GI tract. So after the food is chewed properly or it is mixed with various secretion, it propels backward into the pharynx, and this portion is called as fauces. So this opening from where the food is passing into the pharynx, oropharynx, is called the fauces. So in the mouth there are two cavities, one which is lying in the anterior portion is comparatively smaller, and the other cavity which lies posteriorly is larger. So the anterior cavity is called oral vestibule. So as it is a cavity, so definitely it will be surrounded by some structures. Yes. So this oral vestibule here also and here also, because it is the open mouth structure, okay, but you can imagine in closed mouth as well. So the oral vestibule lies in between the two structure. Anteriorly it is covered by lip and cheeks. The oral vestibule anteriorly covered by the lip and cheeks, and posteriorly it is covered by teeth and gums. So you can imagine this is the whole space where the oral vestibule comes, okay. So starting with the lips are the fleshy folds. Yes, so these are the fleshy fold which is composed of skin externally, then deep to this is the orbicularis oris muscles, okay, and deep to that is submucosa which contain labial glands and blood vessels. Labia means the lip, and the innermost lining is the mucosa which is lined by stratified squamous lining, that is non-keratinized, okay. So because it is protective in nature, because whenever we take any hard substance or any food, that protects our inner lining, okay. So the innermost lining is the mucosa, and the but you can see your mucosa as well. When you turn your lips down, then you can see your mucosal lining of lip there. Yes. So there is a edge in between the mucosa and your skin. So you can put your lips down and you can see the edge which is lining in between the mucosa and the skin is called mucocutaneous junction, okay. But there is one mucosal fold which is lying in both the aspect, that is in upper lip and in lower lip as well, that this mucosal fold of lip is extending till the gum, okay. So this mucosal fold is extending till the gums or the teeth of the upper and lower jaw. So this mucosal fold is called as labium frenulum, okay. So here the whole oral vestibule space is usually covered by the mucosal lining except at the teeth. Yes, so this is the whole space that is called oral vestibule. Now as I already told you that this anterior portion of oral vestibule is formed by lip and cheeks, okay. Now next comes the cheeks. So cheeks are the fleshy flap which maximally covers your face, isn't? And the cheeks or the buccal is mainly composed of the skin externally. Then deep to that is the buccinator muscles, okay, that manipulate your food. It also help in speech, okay. And deep to this muscle layer is submucosa which contains various blood vessels and the buccal glands, and the innermost lining of the cheek is called mucosa, and this is also again made up of non-keratinized stratified squamous epithelial lining, that is multiple layer of flat cells that protect your inner lining of mouth from being damaged by any hard food substance. Yes, so this is called the cheeks, and the cheeks usually connected by the lips by nasolabial sulcus. So this lining is called nasolabial sulcus, where your cheeks ends anteriorly. Okay, so the oral vestibule cavity is anteriorly covered by lip and cheeks. Yes, now on the posterior aspect of oral vestibule are the teeth and gums. So the gums are the supporting structures that envelop the teeth. Okay, at the neck level, these are the fibrous soft tissues which are lined by mucosal membrane as well. Okay, so this is called the smaller cavity which lies in between the lip and cheeks anteriorly and teeth and gums posteriorly. So this is called oral vestibule. Now next comes the larger cavity which lies posteriorly, that is called oral cavity proper here. So this oral cavity proper, so this cavity is anteriorly enclosed by teeth and gums. Yes, anteriorly it is enclosed by teeth and gums, that is the alveolar processes arc. The arc of alveolar process of both jaw forms the anterior aspect of the cavity. Yes, this is the arc which forms the anterior aspect. Then posteriorly it opens directly into the oropharynx. So the opening which lies posteriorly is called the fauces. Okay, so this is called the opening. Okay, fauces. Then on the lateral aspect of oral cavity proper is the cheeks. Yes, and on superior aspect, what you can see here, there is hard palate which is slightly anterior and soft palate which is lying posteriorly. So both makes the roof of oral cavity proper, and the floor part is made up of tongue as well as the sublingual region, the region just below the tongue. Lingual means tongue. So the tongue which occupies the most of the area in mouth, this and the sublingual region forms the inferior part of the cavity. Okay, so here in the roof of this cavity, the hard palate is formed by the bony structure, that is it is formed by the maxilla and palatine bones. So that's why it is hard, and it is covered internally by mucosal membrane. And posterior to hard palate is the soft palate, because there is no bone here. It is a muscular partition. So combinedly this hard palate and soft palate forms a septum or division between the oral cavity and the nasal cavity, because the part of this palate which forms here the roof is the floor of nasal cavity there. So altogether this septa divides both cavity and allows to function at the same time. So because of this septa only you can chew or you can breathe at the same time. So this is one importance. From this soft palate there is one conical hanging structure which hangs posteriorly, is called uvula. Okay, so this is the conical projection from the soft palate, and again from this soft palate there is two muscular fold that extends downward. So here you can see along with this uvula, from the base of this uvula there is one muscular fold is here. So this muscular fold which extends till the tongue is called palatoglossal arc. Palato means it is extending from the soft palate, so that's why it is palato. Glossal means tongue. So the muscular fold that extends from the soft palate and it reaches up to the tongue is called palatoglossal arc. And the another muscular fold that lies posteriorly. Okay, that is also extending from the soft palate only, but that extends from the soft palate and reaches up to the oropharynx, reaches up to the pharyngeal region, is called palatopharyngeal arc. Okay, so there are the two muscular folds, both are extending from the soft palate but reaches in different angle. One is reaching toward the tongue and the another is reaching till pharynx region. So according to that, their names are palatoglossal anterior arc and the palatopharyngeal posterior arc. And in between these, so this is the posterior arc. Okay, so this fold is the posterior and this one is the anterior arc, and in between these two arc there is palatine tonsils. Okay, so palatine tonsils lies in between these two muscular folds, and the opening which lies posteriorly, or you can say the exit of oral cavity, is called the fauces. Okay, so the fauces is the exit point of mouth from where the food finally enters into the oropharynx. Okay, so this was about the structure of mouth, where we have studied about the smaller and larger cavity. The smaller cavity which lies in front is the oral vestibule, and the larger cavity which lies posteriorly is the oral cavity proper. So here in this lecture we have studied about the anatomy of mouth, but the accessory organs that lies inside the oral cavities like teeth, tongue, salivary glands, this all will be covered in the other video. Thank you.